How can you differentiate benign bone tumors from malignant? Imagine finding a lump or swelling in your bone and wondering if it's harmless or something more serious. That's where understanding how to tell benign from malignant bone tumors becomes so important. Bone cancer is a serious condition, but not every abnormal growth in bone is cancerous. Some are benign, meaning they are non-cancerous and usually grow slowly without spreading. Malignant tumors are cancerous and have the potential to invade nearby tissues or spread to other parts of the body, most often the lungs. Differentiating between these two types involves several key steps. First, doctors look at the patient's age and where the lesion is located. Certain benign tumors tend to appear in specific age groups, like osteochondromas in children and adolescents. The location within the bone also provides clues. For example, some benign tumors prefer the ends of long bones, while malignant ones may be found in the shaft or pelvis. How the patient presents also matters. Benign tumors often cause little or no pain or only mild discomfort, whereas malignant tumors may cause persistent, worsening pain, swelling, or even fractures. Imaging tests are crucial in this process. The initial step is usually plain X-rays. On these images, benign tumors often have well-defined edges with a clear boundary separating them from normal bone. They tend to grow slowly and have smooth borders. Malignant tumors, on the other hand, usually show irregular, poorly defined margins, with the lesion blending into the surrounding bone, indicating aggressive growth. The pattern of bone destruction is also telling. Malignant lesions often cause more extensive destruction, sometimes breaking through the cortex, while benign ones tend to cause localized, less destructive changes. Mineralization patterns seen on X-rays can help too. For example, cartilaginous tumors like chondrosarcomas show calcified cartilage matrix, which appears as speckled or ring-like calcifications. Osteoid mineralization indicates bone-forming tumors. The periosteal reaction, or new bone formation in response to the lesion, also differs. Benign tumors usually cause a slow, uniform periosteal response, while malignant ones can produce aggressive, layered, or sunburst patterns. When initial imaging raises suspicion, advanced scans like magnetic resonance imaging are used. MRI provides detailed information about the tumor's extent, involvement of surrounding tissues, and whether the marrow is affected. It helps in planning treatment but isn't definitive on its own. Sometimes, computed tomography scans or bone scans are used to check for spread or to better characterize the lesion. Ultimately, the most reliable way to confirm whether a bone tumor is benign or malignant is through a biopsy. A small sample of tissue is taken and examined under a microscope by a pathologist. This step is vital because imaging alone can sometimes be misleading. Proper biopsy technique is essential to avoid misdiagnosis, which can impact treatment decisions and outcomes. In summary, differentiating benign from malignant bone tumors involves looking at patient age, tumor location, radiographic features like margins and pattern of destruction, mineralization, and periosteal reaction. Advanced imaging helps clarify the picture, but a biopsy provides the final diagnosis. Early and accurate identification is key to managing bone tumors effectively. If you notice any unusual bone swelling or persistent pain, it's important to consult a healthcare professional for proper evaluation. Always remember, each case is unique, and medical professionals are best equipped to guide diagnosis and treatment.